Hey Nicholas, my name is Nurse Jackie. We're going to assess your eyes, ears, nose, throat, and mouth today.
Okay.
We're going to start by having you read the Snellen chart if you can please stand. You can cover your right eye and read the lowest line.
RDEFIL.
Very well. Now cover the other eye, and if you can read it backwards.
LIFEDR.
Now if you can please have a seat. Okay. If you can cover that eye, I'm going to cover the same eye. And I'm going to test your peripheral vision. If you can tell me as soon as you see my fingers.
I can see him. I can see him. I can see him. I can see him.
Okay, now we're going to test the other eye.
I can see him. I can see him. See him. I can see him.
I'm going to inspect your external eyes. If you can raise your eyebrows for me. The eyebrows are symmetrical. Close your eyes, please. Your eyelids meet and your eyelashes are evenly distributed. If you can open your eyes. Your eyeballs are aligned. No protruding. And I don't see anything sunken. I'm going to check your conjunctiva. They're clear. Close your eyes. The upper eyelids, there's no redness or swelling. Okay, I'm going to check your cornea and your lens. It's smooth, clear, no opacities. I'm going to check the other side. Same, smooth, clear, no opacities. And then I'm going to check the iris. It's flat and even colored. Okay, now I'm going to check your pearl. I'm going to just have to shut the light off. Okay, they're round, equal, and reactive to light. Right, now I'm going to check your accommodation. I just have to turn the light back on. Okay, if you can stare at my finger, and then stare behind me. And the back of my finger. Okay, I have a positive accommodation. Inspect your ocular fundus. And look at the other one. Okay, your optic disc is round, creamy yellow with distinct margins. The physiologic cup is half the width of the diameter of the optic disc. The retinal vessels are positive in all four quadrants. The arteries are bright red and more narrow than the veins. There's no twisting or pulsations, no AV crossing. The background is reddish brown in color and clear, no lesions. The macula is positive for foveal light reflex, and all these findings are normal. I'm going to inspect your external ears. Okay, move your head to the right. Now move it to the left. Okay. Look back at me. The ears are equal in size, shape. There's no lumps or lesions. Your ears match the color of your skin. Now I'm going to that up. That. Was there any pain or tenderness when I did that? Okay, now I'm going to look into your ear with this light. There's no swelling. There's no heat discharge, no foreign bodies. Okay, same on that side. Okay, now I'm going to inspect the eardrum. Okay, it's shiny, translucent, and pearly gray. There's no discharge, lesions, or foreign bodies. Inspect this eardrum. Nope, same findings. Okay, now I'm going to test your hearing. Okay, I'm going to whisper in this ear, and as I'm doing it, I'd like you to press on this and keep pressing on it.
Rom-com. Football. Airplane.
Very good. Now I want you to press on this ear and keep pressing it, and I'm going to whisper in this ear, and you're going to tell me the words I'm saying.
Baseball. Sunday. Whisper.
Okay, that was very good. You heard all of that. Now I'm going to do the Weber test. You're going to tell me when you stop hearing this, and where do you hear it?
I hear it in both ears.
Okay. Now I'm going to do the Rhine test. I'm going to put it on your mastoid bone here. You're going to tell me when you stop hearing it.
Stop hearing it.
Okay, now I'm going to put it like this and tell me when you stop hearing it.
Stop hearing it.
Okay, I'm going to test the other ear.
Stop hearing it. Stop hearing it.
Okay, all your findings were normal. Okay, I'm going to inspect your external nose. I'm looking at, make sure it's symmetrical, it's aligned in the middle of your face, and it is. We're going to check for patency now, so I'd like you to press in on this nostril and breathe in with the other one. Okay, and do the same with the other side. Okay, so nostrils are patent. Now I'm going to inspect your nasal spectrum. I can just tilt your head back, thank you. Okay. Check on the other side. Okay, nasal cavity is moist, smooth, and pink. There's no discharge or swelling or bleeding. Now I'm going to check their turbinates. Okay, they're also smooth and moist, no polyps or swelling. Now I'm going to palpate your sinuses. And tell me if there's any tenderness or pain.
No. Nope.
Okay, that concludes our inspection of your external nose. Okay, I'm going to be inspecting your mouth and your throat. Just going to put on some gloves. Okay. I'm going to be inspecting your lips. Okay, there's no cracking or lesions noted. Now I'm going to look at your teeth. Can you just close your mouth? Okay. Teeth are straight and evenly spaced. Now I'm going to look at your gums. Okay, they look pink with no lesions or swelling. I'm going to ask you to bite down to see if your jaw is in alignment. It is. Okay, now I'm going to ask you to open wide. I'm going to inspect your tongue. Okay, it's pink, even colored, moist, slightly rough. Now I'm going to take the gauze and I'm going to move your tongue. If you can stick your tongue out for me, please. Okay. No lesions, white patches on the surface of the tongue. Now, if you can lift your tongue, please, to the roof of your mouth. Okay, there's no redness or nodules. Now, open your mouth, tilt your head back. I'm going to look at the anterior palate. It appears white, and the posterior looks soft and pink. If you can stick your tongue out a little bit. Okay, your uvula looks fleshy pink and is mid-lines. Could you say ah for me, please? Okay. I'm going to just inspect your tonsils now. If you could stick your tongue out so I can see your tonsils. Okay. They're visible and they're +1, which is a good finding. Now I'm going to check the walls of your throat. They're pink with no exudate and no lesions. Okay, done with my assessment.